Okay, so we now go to the individual bacteria with our discussion. Okay, so we're going to discuss first all about the organisms or bacteria which are gram-positive. Okay, so first we have here your Staphylococci. So before that one, so again as a review, we have here the basic difference between your gram-positive and the gram-negative na bacteria. Okay, for the gram-positive, so it would have here very thick na peptidoglycan layer and a very small concentration or decreased concentration of the lipid content, which is much naman na lipid content in your gram-negative na bacteria. Okay, so another one, so for your gram-positive, especially for your Staphylococci, so they are pyogenic. So when we speak about the pyogenic, so they are causing infection which are pus forming or they are producing WBC or simply ang sugat, more of the skin infection. They try to cause your skin infection and most of that would are uh, eventually pus forming or pus producing or may nana na infection. Okay, again as a review, we have here the difference between your gram-positive and your gram-negative bacteria. So with the peptidoglycan layer, again, the gram-positive with a very thick na layer ng peptidoglycan, whereas your gram-negative, we have a thin na peptidoglycan layer, and that would have found here basically on its inner membrane. Teichoic acid and lipoteichoic acid could only be found among gram-positive organism, but not in your gram-negative organism. Periplasmic space could be found here in your gram-negative organism because again, your gram-negative organism contains two layer of the membrane. Meron siyang inner membrane, meron siyang outer membrane. And the space between the inner and the outer membrane is the periplasmic space, which is eventually could be found only in your gram-negative organisms, but not in your gram-positive organism because gram-positive organism would have only one layer of your um, peptidoglycan layer. Lipopolysaccharide, lipid content, of course, again, that would have your high concentration of the lipids among your gram-negative compared with your gram-positive. Okay, most likely little or none at all lipid content for the gram-positive. Okay, so we have here the three genera which are your gram-positive cocci. Okay, so pag sinabing gram-positive cocci, so basically they are round, they are spherical. Okay, so again, they are gram-positive. Your gram-positive cocci includes the three family. We have your Micrococcaceae, Staphylococci, and we have your Streptococcaceae. Okay, so they are differentiated from one another by the catalase test. Okay, the catalase test that will give a positive result for that includes the family of your Micrococcaceae. That includes the genus Micrococcus, Planococcus, and we have your Stomatococcus. Catalase positive is also found here in your Staphylococcus. While your Streptococcus would have here a catalase negative reaction that would differentiate that one from your Staphylococcus. Again, Streptococcus here would have a catalase negative. But all of them are considered to be gram-positive cocci. So mean to say they are spherical, they are round, the shape, and they are gram-positive. Okay, so we have here so we're going to discuss the Staphylococcus. Okay, so we start the discussion with your gram-positive cocci in tetrads or even in your cluster, your Staphylococcus. So it's gram-positive cocci, so I mean to say they are round shape. They form here your clusters or they form here your bunch of grapes. So makikita mo sila parang ganon. Nag-group sila bunch of grapes, grape-like arrangement. Okay, another one, they are facultative anaerobe. Facultative anaerobe, so mean to say they require or they able to survive in the presence or even in the absence of our oxygen. Except your staph saccharolyticus, which is considered to be obligate anaerobe. Pag obligate anaerobe, so mean to say this staph here na species would eventually die in the presence of the oxygen. Dapat walang oxygen ang ating culture media or the environment. But majority of your Staphylococcus here would have considered to be facultative anaerobe, mean to say they able to survive in the presence or even the absence of the oxygen. Again, they are catalase positive, they are oxidase negative, they are non-motile, and able to grow here in 7.5 to 10% sodium chloride. So MSA, mannitol salt agar, so the 7.5% sodium chloride. So they're able to survive or they're able to grow on that culture media. However, some of them are able to ferment your mannitol, others naman hindi sila nagfe-ferment ng mannitol natin. Anyway, we'll be discussing that one mamayang MSA natin. Another one, we have also the small colony variant na Staphylococcus. So, a small colony variant, so it's a rare species of your Staphylococcus here wherein it would have a very small na colony size, kaya nga tinawag siyang small variant. And this one is a fastidious na species. Pag sinabing fastidious, again, these are the bacteria na maaarte. They require an additional growth requirement, like for example, carbon dioxide, or even your hemin here that represent blood. So those are the special requirement, carbon dioxide and the hemin. Okay, so making that one as a fastidious strain of your Staphylococci. Okay, so we have here an overview or the test here that is very important in differentiating your staph, your strep, and your micrococcus. First, we have your catalase test. So, catalase test, identify the enzyme catalase which are present in your bacteria. So, if your bacteria contains this enzyme, it would try to hydrolyze your hydrogen peroxide. This is your substrate to your oxygen and your water. Ang procedure nito, sa slide method lang siya. Okay, so you put on your hydrogen peroxide here, then lalagyan mo ng bacteria inoculum. And all you need to do here is to observe for the bubble formation. So positive result would be identified here by the bubble formation because of your oxygen production as the end product of the entire chemical reaction. So the catalase test again will give a positive result for your micrococcus and your staphylococcus, but not with your streptococcus. Making that one or differentiating your strep with your micrococcus and staphylococcus in terms of their catalase test result. Another one, we have your microdase test. This is the test for your oxidase. Okay, so modified oxidase test that will identify the enzyme cytochrome oxidase. Okay, so ang meron tayong microdase reagent, parang test kit siya. You just need to apply your bacterial inoculum on that, then you add your reagent. And then observe here for the color blue or blue-purple na color. That's a positive result for your microdase test, which is your oxidase test. It's just a modified oxidase test, but still oxidase test pa din siya. Okay, and then it will give a positive result, blue na color. So remember here that our stuff is oxidase negative. Okay, then your micrococcus is an oxidase positive. Both of them, micrococcus, staphylococcus, are all catalase positive. So para ma-differentiate natin if that one is micrococcus or staphylococcus, to perform here your oxidase test or microdase test. And again, it will give only a positive result for your micrococcus but not for the streptococcus. Okay, now we go to the different species of your Staphylococcus. So we start with your Staphylococcus aureus. So we consider here the Staphylococcus aureus as the most important, clinically significant species of your Staphylococcus. So this is usually try to cause here your skin infection. And that one causes here nosocomial infection or your hospital-acquired infection. So you get infected once you are being confined in the hospital or working in the hospital. Okay, we have here the different virulence factors associated or being produced by our Staphylococcus. So virulence factor render your Staphylococcus here to be pathogenic in its ability to cause a disease. The first one, we have your enterotoxin. Enterotoxin, pag sinabing enterics, mean to say that's your gastrointestinal tract. So mean to say if the toxin is enterotoxin, since nasa intestinal tract natin siya, it will cause diarrhea, vomiting, gastroenteritis. Pagtatae ang magiging manifestation ng toxin na yan. This is a type of exotoxin. So pag sinabing exotoxin, so itong toxin na nire-release ng bacteria natin to the environment. hindi siya naka-attach sa bacteria itself. Okay, so your enterotoxin includes here your enterotoxin A, B, C, D, E, G, H, I, G, diba ba? G, H, I, J, K, G to J, ganon. Okay, these are heat stable na toxin. Pag sinabing heat stable, even if you try to heat your food, for example, even up to 100 degrees Celsius, hindi siya namamatay. So, yun ang mahirap sa kanya. Kahit na i-heat natin ang ating food, so still, ano pa rin ang toxic pag ang food natin has been contaminated by this toxin, it try to still cause here diarrhea or vomiting. For the first one, enterotoxin ABD. Again, this is the enterotoxin associated with your food poisoning. Again, this is a heat-stable na toxin. So therefore, kahit initin mo ang pagkain natin, still it will cause diarrhea pa din because your toxin will not be destroyed by heating process. Next one, we have your enterotoxin B. This is associated with your pseudomembranous enterocolitis. Colitis. So, ito si colon. So, manifestation or inflammation of your colon. So, still diarrhea pa din. Diarrhea pa din ang kanyang magiging manifestation. Another one, we have your toxic shock syndrome toxin 1. So, this is your enterotoxin F. So, this try to cause here toxic shock syndrome. So, medyo toxic shock. Di ba, nakaka-alarma ang toxic shock. Okay, so try to cause here toxic shock syndrome among menstruating patient or even in 50% of non-menstruating patient na gumagamit ng tampon. I think sa mga girls, they are familiar with the tampon. So basically, this toxin, nire-release ito ng Staphylococcus natin, which eventually na-absorb ng vaginal mucosa ng patient. And therefore, it try to cause here infection. It try to spread and eventually try to cause a toxic shock syndrome. Okay, again, that's your enterotoxin F. This is your causative agent of your toxic shock syndrome toxin 1. Okay, your enterotoxin B and your toxic shock syndrome toxin are actually considered as super antigen. So, pag sinabing super antigen, diba? Super antigen. So, basically, ito yung mga antigen natin na sobrang immunogenic. Pag sobrang immunogenic, it will activate your T cell and it would have your exaggerated na inflammatory reactions or immune response. Kaya nagiging severe ang manifestation ng kanyang disease. Because again, they are considered as super antigen. Another one, we have the toxin produced by staph. We have your exfoliative toxin or other name for that is your epidermolytic toxin. Exfoliation. So itong toxin nagkakause here ng peeling off ng skin ng patient natin. This is a toxin associated or causing here your scalded skin syndrome toxin or you call it was your Reiter disease. So this is a toxin associated with your bolus empetico. The fourth one, we have your cytolytic toxin. So cytolytic toxin, so from the word is of cytolysis. So try to cause here lysis or damage of your blood cells including your RBC, WBC, platelets, and some monocytes. There are four na cytolytic toxin associated or being produced by your staph. The first one, we have your alpha toxin. Alpha toxin try to cause damage to your RBC. We have also here your platelets and macrophages, which eventually try to cause your tissue damage. Beta toxin, on the other hand, is your sphingomyelinase C. So try to disrupt here, try to damage the sphingomyelin found in the RBC membrane. Okay, and other name for that is your hot cold lysine. Wait, hot cold lysine. Tinawag siyang hot cold lysine here because it's being activated at dalawang temperature. Hot temperature 37 at 4 degrees Celsius at cold temperature. Your beta toxin is also responsible here for the enhanced lytic activity or lytic activity, lysis activity of the beta hemolytic strep in your CAMS test. So pag pinasama mong beta hemolytic strep saka itong Staph aureus, nagiging enhance ang kanilang hemolytic reaction with your blood agar plate or your sheep blood agar because both of them contains the beta na lysine. So, beta lysine is Staph aureus, saka beta lysine ni beta hemolytic strep that would have here enhanced na hemolytic reaction or lysis manifested in your sheep blood agar plate or your blood agar plate. In the culture media, you call that one is your camp, or that's your camp test. Kamsan here for kung sino na-discover nito, we have Christy, Atkins, Munch, Peterson. So again, that would be your beta hemolysis. Okay, another lysine here, cytolysine, we have your delta lysine. Delta lysine is less toxic compared with your alpha and the beta lysine. And usually it could be found here in our coagulates negative na mga species ng staph natin. Okay, the gamma lysine on the other hand, so this is your leucocidine. It tried to destroy our WBC. So other name for that is your Panton Valentine leucocidine. Leucocidine leukocyte, so it tried to damage your WBC. And remember that your WBC is your phagocyte, so pinapatay niya. And therefore that would inhibit the phagocytosis by destroying or killing your phagocyte, which are your WBC. Okay, now we go to the enzyme. So your Staph aureus also produces here several enzymes as its virulence factor. The first one, coagulase. Coagulase converts your fibrinogen to your fibrin clot. So, pag nagkaroon ng fibrin clot, ang mangyari ay tatago doon si Staph aureus natin sa fibrin clot. Pag nakatago na siya within your fibrin clot, ang mangyari niyan, hindi makikita ni phagocyte ang Staph aureus natin. And therefore, it will not be killed by your phagocyte. Okay, so there are two coagulates here being produced by our Staph aureus. One is your cell-bound or clamping factor that could be identified by your slide method. Another one is the extracellular or free na coagulase that could be identified here by the tube method ng coagulase test natin. Another one, we have your fibrinolysin. So, staphylokinase na enzyme. So, fibrinolysin, it-try to lyse your fibrin clot para ma-dissolve ang ating fibrin clot. Okay, so pag nag-dissolve siya, it would allow the infection to spread. So, parang spreading factor ito ni ating Staphylococcus. Again, fibrinolysin or in the form of your staphylokinase. Staphylokinase talaga ang enzyme niya. And staphylokinase is a type of fibrinolysin. Pag sinabing fibrinolysin, try to lyse. Ang activity nito ay try to lyse your fibrin clot that would enable the infection to spread to other tissues. Another one, protease. Protease here is a proteolytic enzyme which hydrolyzes your protein component ng cell natin and further causing tissue damage. Hyaluronidase, try to hydrolyze your hyaluronic acid of your connective tissues and also allows the spreading of the infection. So, spreading factor ang ating hyaluronidase. Lipase, try to hydrolyze your lipids component of your skin. Remember that your skin contains your lipids, your sebum. Ang mga lipids natin, meron silang antimicrobial activity. So, if the Staphylococcus aureus contains the lipase, so they are not removed or be killed here by the antimicrobial activity ng mga lipids natin in the skin. So, making that one, they're able to survive in the skin. That's why majority of our stuff, okay, could also be found here in our skin then. Another one, protein A. Protein A component of your Staph aureus tend to bind with the Fc portion of your IgG antibody. This is your structure ng IgG antibody natin. Itong part ng antibody, Fc dito, Fab dito, Fab. This is another Fab. Okay, this is the Fc component. Usually, ang Fc ito, okay, so dito nagbabind ng ating phagocyte. Okay, para makilala niya. Usually kasi ang IgG natin nagbabind dito sa ating mga bakterya para makilala sila ni phagocyte. However, here ang ginagawa ni Staphylococcus aureus, may protein A siya where it try to block the Fc portion. Iba-block niya itong Fc portion. Ang mangyari ay ang phagocyte natin hindi makabind dito sa ating IgG antibody. Pag hindi siya makapag-bind, it will not recognize the pathogen inside the body. Pag hindi niya ma-recognize kasi wala din siyang binding site, so hindi rin mapapatay ng ating phagocyte ang ating mga organism. Or in the case of this one, so hindi niya mapapatay ang Staphylococcus aureus. So protein A basically try to block here the Fc portion of the IgG antibody, preventing the binding of your phagocyte with your IgG, preventing that one um, to undergo the phagocytosis para mapatay niya ang pathogen natin. And therefore, hindi siya mapatay kasi hindi siya makapag-bind. Another one, beta-lactamase. So this is the enzyme produced by Staph aureus which try to destroy the beta-lactam ring of your penicillin group of your antibiotics. And therefore, this would render your Staphylococcus aureus to be resistant to your penicillin. Hindi magiging effective ang ating penicillin with your Staph aureus because your Staph aureus contains here the beta-lactamase, the enzyme.